Hello, my name is Lauren, and I will be presenting on the disease process and pathophysiology of appendicitis. Appendicitis is the inflammation of the appendix. The appendix is found on the right lower side of the abdomen, and it connects to the large intestine from the cecum. It looks like a finger-like protruding structure that comes out of the large intestine, specifically from the ascending colon. The difference typically between the cecum and the appendix is the appearance. So the appendix, like I mentioned, it is more narrow tubular structure, and the structure of the cecum is shaped more like a pouch. The role of the appendix, it plays more of a role of storing good bacteria in your GI tract, while the GI tract is trying to recover from a diarrheal illness. It also helps maintain the healthy GI flora of the gut. So when your GI tract is rebounding from, like I mentioned, diarrhea or any other illness, it's because the appendix has that presence of lymphoid tissue, and it is suggested that the appendix has a role in immune function and the beneficial effects of the gut. This is also due to the appendix having biofilm that is that after certain diseases get eliminated from the gut, the biofilm of the appendix produces this beneficial bacteria back into the gut. Appendicitis is one of the most common abdominal surgeries performed, and with the highest incident occurring in individuals ages 10 to 19 years old. And the prevalence is higher in men. The causes of appendicitis are obstructions caused by hard fecal mass, infectious processes such as parasites or worms, kidney stones, ingesting an object or a foreign body that may have been ingested, inflamed lymphoid tissue, or a benign or malignant tumor. Approximately 90% of patients with appendicitis experience inflammation. This is due to lack of blood and oxygen to the tissue. This is where necrosis may occur, and perforation of the appendix is at risk. It is a medical emergency if appendicitis is left untreated. Within that 48 to 72 hours, the incidence of rupture can lead to a more serious complications such as peritonitis, which I will discuss a little bit further. The pathophysiology of appendicitis. The appendix contains this mucosal layer. So there's an ulceration that happens within the lining of the mucosal, and the appendix becomes inflamed and temporarily obstructs the appendix. So whatever that may be causing this obstruction of the lumen, the appendix, whether it's stool, a tumor, or foreign body, this is what increases to the luminal and intramural pressure. This leads to mucus outflow to the appendix, and this is where it becomes distended and begins to contract. The fluid has nowhere to go, and it continues to be secreted, and it becomes stagnant. As the appendix becomes increasingly engorged from this bacteria multiplying and the pressure from the inflammation, this causes the occlusion of the blood flow, causing a thrombus. This is where you'll see your peri-umbilical abdominal pain begin, and ischemia to the wall of the appendix. As the inflammation from the bacterial overgrowth and fluid collection continues, perforation of the walls of the appendix cause spillage of appendiceal substances into the peritoneal cavity. This is where you're seeing your more serious complications manifest. The perforation leads to abscess forming at the location, and the rupture manifests into peritonitis. Treatment, if it's indicated, treatment would be removal of the appendix, which is appendectomy. This can be performed laparoscopically or unless a perforation is present, or you can see that drainage of the localized abscess can happen as well. The risk factors, younger age, males, as I mentioned, family history, inflammatory bowel disease, major signs and symptoms. If you see, you can follow, symptoms vary due to the location of the tip of the appendix. I wanted to mention that. Also, a good way to remember signs and symptoms, you can, based on the word appendix. So abdominal pain would be your first symptom. So A for appendix, A for abdominal pain. Initially, this pain starts as a dull peri-umbilical cord at that location. However, as the inflammation progresses, it moves to the lower quadrant. Point of McBurney, this is a point of tenderness, which is described about 1.5 to 2 inches between the belly button and the anterior superior iliac spine. Poor appetite, elevated temperature, nausea, vomiting, desire to lay on one side with the knees bent in fetal position. This helps relieve pain for individuals with appendicitis. I'll just go over a couple more. Rebound tenderness. I want to mention there's 3 signs located below. I hope I pronounce these correctly. The Rosing sign. This is when you're palpating the patient on the lower left quadrant, but there's pain in the right lower quadrant. psoas sign is when the patient has their hips flexed and pressure is applied to the knees, then you'll see that pain in the lower right quadrant. And the obturator sign, this is more with pelvic appendicitis. This is when internal rotation of the hip may initiate lower quadrant pain. So diagnostic testing, you'll see your white blood count with differential neutrophil test, C-reactive protein test. And as you notice to the right, I have noted what to expect from those diagnostic testing results. Bilirubin test, perforated appendix. Temperature will be greater than 103. Your white blood cell count will be greater than 15,000. And then imaging will show fluid collection in the lower right quadrant. As you see, I noted imaging, CT scan, and ultrasound MRI. To the right, you'll see what that is going to show under imaging. I do want to finish this up, note that a variety of inflammatory and infectious conditions in the right lower quadrant can mimic signs and symptoms of acute appendicitis. I'll name a few. Cecal diverticulitis. This occurs in young adults as well. It presents with signs and symptoms that can be virtually identical to those of acute appendicitis. You have Meckel's diverticulitis. You have Crohn's disease that can also present with very similar symptoms such as fatigue, prolonged diarrhea, abdominal pain, weight loss, fever without gross bleeding, and ruptured ovarian cyst is one, and testicular torsion. Thank you for watching and have a good day.